Hello, my name is Lily Funk, and I'm doing my chemistry capstone project on the question of why is methotrexate used to treat autoimmune diseases? So, what is an immune system and what does it do? In the human body, our immune system protects us from deadly viruses. The immune system works to fight off sickness as well. Important parts of our immune system, these are just some, not all. White blood cells, which are the main component in fighting off harmful germs. The spleen stores white blood cells and filters blood. And the skin is like a natural barrier between the outside world and the inside of our body. I really like this picture on the right hand side here because it really shows how the immune system, or it just represents what the immune system does to fight off these germs and bacteria that we do not want in our body to cause sicknesses. So I just wanted to point out some things you can proactively do to strengthen your own immune system. So an important one is stress management because when a person is stressed out, they're much more vulnerable to diseases and your body is almost shutting down a little bit. Exercise is always important, sleep, and feeding your body well with good nutrients will help you fight off the bad bacteria and germs, like this woman in the images, provides kind of a shield if you do all these things right. It'll set you up to not get sick. So, what is an autoimmune disease? Autoimmune diseases are when a person's immune system attacks its own healthy body cells. This prevents cells from performing effectively, which creates issues. And so, kind of in the image here, you can see on the left side, the body's acting, the immune system's acting normal. Um, the good cells are fighting the bad cells, but on the other side, the good cells are getting confused and they're attacking other good cells, which is causing these issues in the body. Some common autoimmune diseases that you may have heard of in the past or know somebody that has these. One is rheumatoid arthritis, which is an inflammatory disorder that affects the joints. And I have an image here that shows kind of the inflamed parts of your body. It obviously inflames the joints, can make them hurt. They can be sore. And then another autoimmune disease is ulcerative colitis. This is a disease that happens in the bowel. Um, and this could cause lots of issues because it'll affect the digestive system and it'll throw that off. So it could lead to an uncomfortable and painful spot for patients or people that have this. And then psoriasis is a skin disease. Um, kind of has rash, you kind of get rashes or red lesions on your skin, which can be very painful. So, the history of methotrexate. Methotrexate was introduced in the 1940s, and it was first introduced as a cancer treating drug. And then in the 1970s, the FDA approved methotrexate for treating psoriasis after much research and testing. And then in the 1980s, methotrexate was then approved as treatment for rheumatoid arthritis. And then from 1990 to the present day, methotrexate has now been used to treat many more autoimmune diseases through more research and discovery. So, why methotrexate? Methotrexate is important because currently there is no cure for autoimmune diseases. Methotrexate is also an immunosuppressant medication. This means that it slows down the body's immune system from attacking its own healthy cells. So it kind of, if a person wasn't taking methotrexate, their symptoms would probably increase at a more drastic rate. So this will slow it down and hopefully make the person's disease not affect them as much by helping them improve the symptoms. And another methotrexate is also used or known as a disease modifying antiarrhythmic drug. And like I said before, methotrexate is also used as a cancer treatment, which I thought was very interesting. Before it was used for autoimmune diseases, it was used as a cancer treatment. Doctors prescribe methotrexate as either in tablets so people can swallow them, or it can be given through injection, which I thought was interesting. And it has to be doctor prescribed. And through my research, I found that people usually take methotrexate about 1 time a week. So in my connection to chem class, I found that methotrexate, in the when a person takes methotrexate, it allows lots of reactions to be going on inside the body, which helps the immune system calm down and stop from fighting itself. We learn a lot about reactions in chemistry and chem lab, and this is a different reaction than what we've learned, but it's one of the important reactions where you see a change in your body and it helps people, which I thought was very interesting. And another connection to class is we learned a lot about molecular formulas and different elements. And as you can see here, methotrexate's molecular formula is C20, H22, N8, and O5, which is a more complex molecular formula than some of the formulas we've looked at in class. And then building off of that, we learned a lot about Lewis structures and learned how to draw in Lewis structures. As I showed in the picture here, you can see methotrexate is very complex. It's not something that we would have done in class, but it's cool to look at because I could kind of piece together some of the things that we learn in class and learn the molecular geometry and stuff like that. So I thought that was very cool and interesting. And then here are my sources. Thank you for listening.